Hello and welcome everybody. Myself Dr. Dipak Patil. I am Medical Director and Consultant Diabetologist at Diabetes Relief, Mumbai. Today I am going to talk about complications of uncontrolled blood sugars in diabetic patient. According to the ADA guidelines, whose fasting blood sugar is more than 112, postprandial blood sugar is more than 180 and HbA1c is more than 6.5 is termed as uncontrolled diabetic patient. Today we are going to talk about uncontrolled blood sugars complications. The first and foremost complication would be renal disease. In uncontrolled diabetics, filtering capacity of both of your kidney gets severely compromised and many of the essential proteins get washed out through your urine. This may lead to end stage renal disease as well as kidney failure, and you may require dialysis after that. The second complication would be heart attack and brain stroke. Uncontrolled diabetes first hit on major blood vessels. The blood vessels which supply your heart and brain will severely get affected. Because of that, the cholesterol balance also get disturbed, and most of the patients who get heart attack often asymptomatic. Means there would be no signs or no pain to the patient during the heart attack. But because of the stroke, the patient can be bedridden and his quality of life is get very compromised. The third complication will be eye complications. The tiny vessels which supply your eyes also get affected because of uncontrolled blood sugar. And these tiny blood vessels are getting damaged, rupture because of uncontrolled blood sugar, and this may lead to cataract, blindness or glaucoma and complete loss of vision. Third complications will be of a foot complication. Because all your peripheral vessels get affected because of uncontrolled blood sugar may lead to peripheral vascular disease, that means PVD, as well as the nerve which also get affected because of uncontrolled blood sugar called peripheral neuropathy. And because affected major vessels which supplies the leg and foot may leads to loss of sensation as well as foot injury, and because of the foot injury there would be amputation as well as gangrene can occur to uncontrolled diabetic patient. Sexual complications. Uncontrolled blood sugar hit male and female patients equally. The male patients get erectile dysfunction because of high blood sugar and may also lead to retrograde ejaculation, which leads to infertility. In female, it affects equally and cause to infertility. Last but not least complication is obesity. Obesity increases the risk of comorbidities like hypertension, PCOS, that is polycystic ovarian disease, which is in female, dyslipidemia, as well as insulin resistance. Because of obesity, there is a plight of problem occurs to diabetic patient, and it increases the healthcare expenses, as well as because of obesity there is a difficult task to manage uncontrolled diabetes. So friends, diabetes is a multi-headed demon which appears through many forms, but because of uncontrolled diabetes there is series of complications and which requires a careful attention, regular medications, regular follow-up, as well as diet and exercise management to the diabetic patient. And at Diabetes Relief, we give you a complete attention to every aspect of diabetes management. Thank you very much.